Hi, so it's Dr. Kelly Clark over here at Patient PT, and things are starting to get a little bit more back to normal out there. So I thought it would be a good time to make a video and talk a little bit about some of the things that I've been doing to try to get things back to normal over here at Patient PT. So, as many of you are already aware, I did temporarily shut down my clinic since the COVID-19 pandemic started to take hold in the United States back in March. But that was primarily because I was helping out with a community effort to provide fabric masks, and I was temporarily offering my clinic space as sort of a holding point and sorting point for that mask drive. But fortunately, City of Bloomington stepped in, and I was able to get that out of my clinic relatively soon. And as you may be aware, physical therapy is considered an essential medical service, so I actually have not been required to shut down my clinic at any point during this. And so I have started seeing more clients and patients again as folks have become more comfortable, and of course, as I have become more comfortable. And so for those of you who haven't been in a while or maybe have never been here, I just wanted to give you a heads up on what you can expect when you get here. So first of all, one of the biggest changes is that the main entrances of Executive Park North, where Patient PT makes its home, are actually locked right now. So I will be greeting everybody who comes to see me up there at those front doors, so that first of all I can unlock those two sets of doors for you, but also so that I can start our visit off the right way by asking your permission to do an infrared temperature screen. Okay, so this is just a thermometer similar to the ones that you put under your tongue that you may be a little bit more familiar with, but unlike those, it doesn't require any contact. I can just hold it and hold it up to a person's head, hit that little button, and it'll beep and give me a temperature readout in just a second there. So you can see I'm reading at 97.2 right now. It's well within normal. And as long as your temperature doesn't come up as greater than 101.3, that's all that you really have to worry about as far as that's concerned. In the event that your temperature is looking a little bit high, I also have a O2 saturation monitor. It's called a pulse oximeter. And basically what that means is that you hit this button, you stick your finger inside, and it will give you a readout that says how much oxygen your blood is carrying out of a total possible percentage of 100%. So you can see my O2 saturation right now is at 98%, and my heart's beating a little bit fast there too. It's got 75, 74. I will double check your O2 saturation if it looks like your temperature is a little bit wonky. Just as a precaution to screen folks for COVID-19 before they come into the building. I will also be wearing a mask myself and offering anybody who comes to visit me a mask to wear. I will ask that you wear these masks while you're in the shared parts of my building, just as a courtesy to the other folks who share office spaces here at Executive Park North. However, once we are here inside my private clinic, you are welcome to take that mask off if it makes you feel a little bit more comfortable, if it's a little easier for you to breathe. I will keep my mask on for the majority of the treatment, but as much as I talk, sometimes I do just need a little bit more oxygen. So if I do need to take my mask off, I will just take a couple of big steps back from you, even though I will probably already be maintaining something close to that 6-foot distance, and talk for however long I need to, and then replace my mask. But for the most part, I will be wearing masks during my treatments. I'll have my hair up like I do right now so that I don't have to worry about my hair falling in my face and potentially touching you and, contaminating you with my potential germs, or contaminating myself with your potential germs, because that's kind of what all this is about at this point. We're just kind of trying to protect each other from an enemy that we can't necessarily see. One thing that hasn't changed is that Patient PT is a sole provider clinic. That means that I greet everybody personally. There's no billing clerks or techs or anything like that here in my office. It's just you and me, some good old-fashioned PT. So there have never been any issues with, reaching limitations on the number of people who can be here in my office, and there never will. There are no busy waiting rooms. I also have always had a policy of seeing no more than 6 patients per day here at Patient PT, and that's because that is the number that I can see during a reasonable working day and still allow a half hour in between every visit's minimum so that I can take some time to review my notes, finish up my documentation on one person before I turn my attention to the next person, and also, of course, have a little bit of time to review their file before I get started on them. And I think that that just makes me a better practitioner, but it's kind of a bonus during these times because it gives me a little bit of extra time to sanitize my clinic in between visits as well. So one of the things that of course hasn't changed is that I sanitize my instruments using disinfecting wipes that kill viruses and bacteria. Anything that gets touched directly during a visit, of course, gets sanitized using those same antiviral wipes. But in addition to that, I've also added what's called a UV sterilizer to my office. So UV sterilizers are used in hospitals in order to sterilize rooms in between patients, and they also use them in operating rooms sometimes. That is one there over the corner, and it's just kind of a small unit because I've got a small office, but basically it just has a couple of light bulbs that you can sort of see now that I've stepped a little closer. Those will light up with a blue UV light that is able to kill viruses and bacteria, and it runs for 15 minutes, and when it's done, the whole room and everything in it has been sanitized. I've also added some shelving and stuff and moved things around here at the office so that I can keep everything that needs to be sanitized in between visits kind of in one place. Makes it a little easier on me and helps me to be a little bit more consistent. And I also, of course, will take my instruments, like my Graston instruments or anything else that I use, lay that out on the table here while the sanitizer is running, just so I can make sure that everything gets a little bit extra clean. Let's see. Of course, I also will be wearing gloves during any hands-on treatments that I do. Gloves, of course, were a little bit hard to come by even for a while there, but I have several boxes here and I'm ready to use them in the event that you need a little bit of hands-on treatment or Graston treatment in order to feel better as part of your physical therapy. And one other thing that I did want to mention is that these masks that I have here in my office are actually made of it's called a halyard surgical drape, and what it's usually used for is in hospitals they will wrap up freshly sterilized surgical instruments in this stuff. So it has been tested for different types of medical uses, and there was a doctor down at University of Florida that realized that because it's already been rated to filter out pathogens that are trying to get onto surgical instruments, it might also be a really good filtration surface to make a mask out of. So he determined that these masks are actually N99 rated, which is a slightly higher level of filtration than those N95 masks. Of course, these are not lab tested medical equipment, and they don't have as tight of a fit on your face as an N95 mask would have, okay? They fit more like a standard surgical mask where the nose bridge is the main thing that gives you a nice tight fit, okay? And you can see now that this is on my face, it does have a pretty nice tight fit. And these are the same masks that I offer to folks who come in here to see me. You can take it home, reuse it, wash it. They are washable, or you can give it back to me and I will wash it and reuse it. But I think that that's it. That's kind of all the things that I've been up to over here at Patient PT to keep the folks who are coming in to see me feeling safe. I hope that this video helps those of you who still are not feeling so safe going out into public spaces and particularly healthcare environments feel a little bit better about what you will experience when you come over here to Patient PT. And of course, as always, I pride myself on being a very patient-centered practitioner who really gets to the root causes of your pain and helps you understand what you can do in order to control it on your own without having to come back and see me over and over again, okay? So come see me, try Cash PT. It's pretty awesome to be able to just work with your healthcare provider on the things that you prioritize instead of the things that get the best reimbursement through an insurance company. And you'll see if you visit my website, patientphysicaltherapy.com, that my rates are actually very reasonable. They're all posted for anybody to see so that they know exactly what they're getting themselves into when they come into my visit. And because all services are paid at the time of your visit, you will never ever receive a bill several months down the line that you were not expecting from patient PT. So that's my little spiel. That's what's been going on over here. These are all the various little things that we're doing, that I am doing to keep you safe. If you come to see me, I hope that this gives you some peace of mind and that you are otherwise staying safe and healthy out there. I'd love to help you out if you've got some pain that you would like to get rid of for not just a week or a few days, but for the rest of your life. Stay safe.